Hey guys, so this will be the chapter 15 lecture. I'm downstairs in our basement today because my boyfriend is home working from home today. He has the wonderful opportunity to do that, but I do not like recording in front of him as much as I've known him for 16 years and love him to death. I'm still shy. I'm not one of those people that takes selfies all day long and sends them to my friends or Snapchat. And he's already threatened to come down here, so if you see a hand over on the stairway, that's him being creepy. I told him to stay out. I said I was going to lock the door, and then I realized that there was no lock. So, again, keep an eye out for that hand. As you can see, this is where we do laundry, where we work out sometimes. There's probably some weights back there somewhere. So, it's a little different down here. Lighting's not as good. Hopefully we'll get through it, though. First things first, Chapter 15 is urinary system drugs. This primarily affects the bladder, the prostate, that sort of thing. So it's really super focused in there. The most commonly used drugs influencing the function of the urinary tract are diuretics. So even though we're talking about the bladder, we're getting rid of water from the entire body. Usually this water is affecting other parts of the body, the lungs, maybe there's swelling in the feet and the hands. So focused on the bladder, but we're getting rid of water. So diuretics are divided into 5 categories based on their actions. There are thiazides, loop diuretics, potassium-sparing diuretics, osmotic agents, and carbonic anhydrase inhibitors. Thiazides and related diuretics, these are frequently used. They're probably one of the most commonly used drugs when it comes to treating blood pressure. It gets rid of water, sodium, chloride, and potassium. So the prototype of this class is hydrochlorothiazide. Sounds exactly like the main title there, thiazide. Uses of thiazides include the treatment of edema. We already sort of discussed that. That can happen from heart failure or cirrhosis. Fluid starts to build up in the body and you need to get rid of it to prevent shortness of breath, as well as pressure on other organs. Hypertension, either alone or combined with other drug classes. And prophylaxis or preventative treatment of calculus or stone formation in patients with excess calcium in the blood, or the urine, in the urine. Side effects. So we talked about how hydrochlorothiazide gets rid of, and other thiazide diuretics get rid of not only water, but also potassium. One of the major side effects seen with thiazide diuretics is hypokalemia, meaning low potassium. We worry about potassium because when it gets too low, it can cause arrhythmias or problems with the heart. Hyponatremia, remember it gets rid of sodium as well, can also cause issues. Hypercalcemia, which is abnormally high blood level in the calcium, can also be caused by thiazide diuretics. Muscle weakness or spasm. Postural hypotension or decreased blood pressure when somebody stands up from sitting or laying down is a side effect, as well as hyperglycemia and increased uric acid level. And usually that's because we're getting rid of excess fluid, so now that stuff is more concentrated in there. So precautions or contraindications with thiazides apply to people with diabetes because it can cause hyperglycemia. If somebody has a history of gout, because one of the side effects is increased uric acid level, and gout is a problem with too much uric acid. We have precautions in severe renal disease, impaired liver function. We don't want to use it too long without a potassium supplement, and older adults may be more sensitive and it may cause a lower sodium level. If somebody is also sensitive to sulfonamides, we would want to be careful with thiazide diuretics as well. Let's go back to severe renal disease. You'll see thiazides used up until a point in severe renal disease, or up until a point where the patient has severe renal disease, and then they're not used anymore. We switch to loop diuretics because thiazide diuretics cease to be effective, and when they're not effective, there's no reason to give them. Sometimes you will see them attempted to be used in a last-ditch effort and paired with loop diuretics, sort of as a, let's see if we can sort of kickstart this kidney into producing urine, but it doesn't really always work that well. So, interactions, again, I never like to cover these too extensively. This should be something that the pharmacist is looking for and that you could look up while you were on the job. Keep in mind when we talked about postural hypotension, so if you've got a patient on thiazide diuretics, we want to be careful before we just stand them up and get them moving. These people need to come from laying to sitting to slowly standing up. Otherwise, their pressure could drop, and next thing you know, your patient's on the floor. Same thing pretty much goes with loop diuretics. So that's our next class. loop diuretics act directly on the loop of Henle in the kidney, which is why they're called loop diuretics. They inhibit sodium and chloride reabsorption, which if you send sodium and chloride back into the urine, water will follow. It's just from higher gradient to lower gradient. Potent diuretics or loop diuretics include furosemide, which is also called Lasix, bumetanide, which is also known by the brand name Bumex, and torsemide, which is known by the brand name Demodex. So they kind of have the same action, they just act in a different place in the kidney as thiazides. So they're going to have the same uses as well as the same side effects. So uses include edema, as seen with heart failure or cirrhosis, pulmonary edema, ascites caused by cirrhosis, as well as hypertension. And you will see these dosed higher and higher in hypertension and CHF to get rid of fluid. Especially as kidneys start to fail, loop diuretic doses can reach pretty extreme amounts. Side effects can include that, again, hypokalemia, hyponatremia, and in this case, hypocalcemia. Because of the different method of action, you're going to see slightly different electrolyte changes. Hypotension, again, we want to get these patients up slowly. Hyperglycemia and increased uric acid level. So as you can see, thiazides and loop diuretics are very similar, just slightly different mechanism of action. So we want to be careful for all the same reasons. And maybe a couple extra here, but really the focus is we want to be careful in patients who have diabetes, a history of gout, pregnancy and lactation. You'll probably see as a precaution on almost every single drug out there. Always do your research before you start giving pregnant ladies or those who are breastfeeding drugs. It's time to fold the laundry soon. Potassium sparing diuretics. These do exactly as their name implies. They work in a different place, and that causes potassium not to be able to follow the water. So because potassium depletion can be dangerous, somebody who is at risk of hypokalemia might take a potassium-sparing diuretic. Also, they'll sometimes balance one diuretic that doesn't spare potassium with a potassium-sparing diuretic. Therefore, you don't see as much change in the potassium levels. So they are seldom used alone, as I just said, and they can cause hyperkalemia on the other side. Instead of causing the potassium to drop, potassium gets too high. Hyperkalemia can be just as dangerous as hypokalemia, if not more so. So again, we want to keep an eye on our electrolytes. Side effects of potassium-sparing diuretics aside from hyperkalemia: GI symptoms, fatigue, lethargy, hypotension, and a nasty little thing called gynecomastia, which is really a problem in men. It's enlargement of the breast tissue in males seen with spironolactone. So be careful with that drug in males. Caution with potassium-sparing diuretics is indicated in patients with renal insufficiency, cirrhosis, and there we go with those pregnant women again. So let me see if we're going to be able to fit this into one lecture. I don't know, maybe not. Osmotic agents such as mannitol are used most frequently to reduce intracranial or intraocular pressure. You'll really only see them used in the OR, possibly in the ICU. They're not used as commonly as loop, thiazide, or potassium sparing. Side effects include fluid and electrolyte imbalance, CNS symptoms, GI symptoms, etc. Extreme caution is indicated in kidney and cardiovascular function should be evaluated before administering these agents to anyone with kidney failure, heart failure, severe pulmonary edema, and again, those pregnant women. So, Table 15.1 has the generic names for some of our diuretics as well as some common doses. This is a great place to pull your Drug Information Project drugs from. If you are wondering what to put in that table, boom, right here. If you haven't already done your project, I'm sorry, I'm remembering this is the beginning of the mod for when I'm recording this, so just a hint, here's where you get them. Gout, wow, that dryer really wants me to fold those clothes. Medications for gout. Gout is a form of arthritis. Gout is caused by the accumulation of uric acid crystals in various joints, especially the big toe, where it's most commonly seen, however, other joints as well. Sometimes the kidneys too, with resultant inflammation and pain. Gout's extremely painful, comes on quick, which is why they call it an acute attack. And we want to treat this as quickly as possible for these patients. Usually the area that's affected will be red, warm, and swollen. And usually the pain is started to be treated by NSAIDs, such as naproxen, indomethacin, ibuprofen, and it started as soon after symptoms appear. So this isn't to treat the problem, this is really just to treat the symptoms, but we need to get rid of those symptoms and help the inflammation come down. Corticosteroids are also useful. Colchicine is another anti-inflammatory. It's not an analgesic, it's more of it decreases inflammation, and it also does not affect uric acid clearance, so again, not going to treat the problem. Colchicine can be used prophylactically at low doses to prevent recurrent attacks, which is a good piece of information. You won't see someone on colchicine just momentarily. They might be on it every single day to prevent those attacks. Little known fact, colchicine is also used in post-op CABG patients, which is cardiovascular arterial bypass grafting, which is when someone has a heart attack and we need to help their heart begin to get blood again. That's the surgery they have. Colchicine is used afterwards, post-op, in order to decrease inflammation around the heart. Little known fact, colchicine. So side effects of colchicine can include rash, hair loss, GI upset, nausea, vomiting, and diarrhea, blood disorders, as well as bone marrow suppression. Some serious things, but really not as common as you might think. Uricosuric agents such as probenecid act on the kidney by blocking reabsorption and thereby promoting getting rid of uric acid, which is exactly what we want to do in someone with gout or having an acute flare. It's used in chronic cases and frequent acute attacks. However, they will not treat the symptoms and therefore are not effective in treatment of the symptoms of acute attack. Probenecid is sometimes also given with penicillin because it increases the level of penicillin in the blood. It prevents it from being excreted. So that's also a little side fact about probenecid. Side effects include headache, nausea, vomiting, kidney stones, and renal colic if large volume of fluids are not maintained. So it's pretty simple. It's not a very harmful drug. And precaution, we need to be careful, of course, if we're worried about causing kidney stones. We need to be careful in patients who have a history of uric acid kidney stones, a history of peptic ulcer, renal impairment, or hematologic disease. You cover the interactions, don't worry about them too much though. Our next class of helpful medications for gout, xanthine oxidase inhibitors, specifically allopurinol, is the prototype for this class. It results in decreased serum levels of uric acid, and it has no analgesic or anti-inflammatory activity, so it's not going to treat the symptoms, but it will help get rid of the problem. It's also used for the prevention of renal calculi in patients with a history of frequent stone formation, as well as the prevention of acute hyperuricemia or increased uric acid in the blood during radiation of certain tumors or anti-neoplastics, aka chemo. Swear to God, I wish I had not turned that thing on before I started recording. Side effects of allopurinol include rash, allergic reaction. Severe hypersensitivity reactions are rare but increase in older patients with renal impairment. So careful with our older patients or those with impaired renal function. So I'm going to pause this here and move on to a second lecture to cover the rest of the chapter because I don't want to rush to get through it. Because I think YouTube only gives you 15 minutes per video. So stay tuned for part 2.